The outbreak was confirmed to have spread to Italy on January 31, 2020, when 2 Chinese tourists tested positive for SARS-CoV-2 in Rome. Cases began to rise sharply, which prompted the Italian government to suspend all flights to and from China and declare a state of emergency. An unassociated cluster of COVID-19 cases was later detected, starting with 16 confirmed cases in Lombardy on February 21, 2020. On February 22, 2020, the Council of Ministers announced a new decree law to contain the outbreak, including quarantining more than 50,000 people from 11 different municipalities in northern Italy. Prime Minister Giuseppe Conte said, in the outbreak areas, entry and exit will not be provided. Suspension of work activities and sports events has already been ordered in those areas. On March 4, 2020, the Italian government ordered the full closure of all schools and universities nationwide as Italy reached 100 deaths. All major sporting events were to be held behind closed doors until April, but on 9 March, all sport was suspended completely for at least 1 month. On March 11, 2020, Prime Minister Conte ordered stoppage of nearly all commercial activity except supermarkets and pharmacies. On March 6, 2020, the Italian College of Anesthesia, Analgesia, Resuscitation and Intensive Care, (SIARDI), published medical ethics recommendations regarding triage protocols. On March 19, 2020, Italy overtook China as the country with the most COVID-19 related deaths in the world after reporting 3,405 fatalities from the pandemic. On March 22, 2020, it was reported that Russia had sent 9 military planes with medical equipment to Italy. As of 28 March, there were 3,532,057 confirmed cases, 107,933 deaths, and 2,850,889 recoveries in Italy, with a large number of those cases occurring in the Lombardy region. A CNN report indicated that the combination of Italy's large elderly population and inability to test all who have the virus to date may be contributing to the high fatality rate. On April 19, 2020, it was reported that the country had its lowest deaths at 433 in 7 days, and some businesses were asking for a loosening of restrictions after 6 weeks of lockdown. On October 13, 2020, the Italian government again issued restrictive rules to contain a rise in infections. On 11 November, it was reported that Silvestro Scotti, president of the Italian Federation of General Practitioners, indicated that all of Italy should come under restrictions due to the spread of COVID-19. A couple of days prior, Filippo Anelli, president of the National Federation of Doctors' Guilds, FNOMCO, asked for a complete lockdown of the peninsular nation due to the pandemic. On the 10th, a day before, Italy surpassed 1 million confirmed COVID-19 cases. On 23 November, it was reported that the second wave of the virus has caused some hospitals in Italy to stop accepting patients.